Hey everybody, it's Dr. Jeff with another one of my regenerative moments. This is a study that I just recently discovered. I was surprised that the study was published in January of 2021, and I had not found this study until about 6 weeks ago. It was published in a journal called Scientific Reports. And I thought by the quality of the study that it should be in one of the big orthopedic journals, but has not yet made it to one of the big orthopedic journals. It is a multi-center study. It was done partially in India, partially in the United States and Oregon, partially in Puerto Rico, and then in Romania. And what it looks at is it looks at a total of 150 patients in the study, 75 in the control group that received orthopedic HA into the knee for osteoarthritis. And in the study group, 75 patients that received PRP, and they received a quantity of 10 billion, that's with a B, billion platelets in a total of 8 cc's of injection fluid. Now, I disagree with the 8 cc's of injection fluid. I think they should have concentrated it down to about 5 cc's. We know that the one thing that is a pain generator inside the knee joint is the joint capsule. And if you distend the joint capsule, then you typically get pain. And if we over-distend the capsule with an injection, we will often get pain for about 3 days. I always talk about the rule of 3, that in 3 days everything we inject is gone. In 3 weeks we start getting some regeneration, and it takes about 3 months to reach its maximum effect. And the study actually sees some of those findings. So I would have concentrated a little bit more down to about 5 cc's. I think it would have been more tolerable for the patient. But what the study looks at is it actually looks at 3 significant outcomes. It looks at the WOMAC score, which is the Western Ontario McMaster's University Arthritis Index. It looks at MRIs done at the beginning of the study and at 1 year, and they're looking for chondral protection. They're looking at the cartilage that makes up the end cap of the femur overlying the distal femoral condyles, and they're measuring the thickness of that articular cartilage cap. And then they're looking at the results of a 6-minute walk. So if we start out at the beginning with the WOMAC score, what they found was, and I'm not surprised, is at 1 month, both groups, both the HA group and the PRP group, were significantly better. And we know that from anyone that has injected any of the orthopedic HA products, whether it be Synvisc or Orthovisc or Hyalgan, into a joint, you get about a month to 6 weeks of improvement in function and pain because it acts as a cushion between the 2 bones. And usually around a month to 6 weeks, it starts to wear off. So I would not be surprised to see both groups doing well at 6 weeks. Now, the HA group had marginal improvement at the 3-month period, and then went back to baseline by 6 months. They said at 3 months it was statistically insignificant, the change at 3 months. Now, if we look at the PRP group, the PRP group continued to improve all the way out to 1 year. So they were equal to HA at a month, better than HA at 3 months, and then continuing through 6 months and a year continued to be better. So obviously the PRP group had less pain and increased function. That's what the WOMAC score looks at. It looks at both pain, stiffness, and function of the knee joint. So all of those scores were significantly better. Now, the second parameter that they looked at was chondral protection. And I think that this is a shift in the way that the doctors performing these studies look at their outcome. Early on in orthopedic research, we were looking for increase cartilage formation in the joints when we inject PRP. We were hoping that PRP would help the joint make new cartilage. But what they're looking at here is not the fact that the body is going to make new cartilage, but what they're looking at is, can the cartilage that's already in the joint be maintained? Now remember that these are patients that have grade 2 to 3 osteoarthritis. So what would you expect to happen just with time? You would expect the knee to continue to wear. As time passes, the articular cartilage would continue to wear to the point that at some point the patient would need a knee replacement. Well, what they found with this study is they looked at, like I said, here are some MRI images of the knee, and they looked at the cap at the end of the femur on the femoral condyle. And what they found is no significant change in the thickness of the cartilage at 1 year. In the PRP group, 82.8% was unchanged at 12 months. In the HA group, only 61.7% was unchanged after that period of 12 months. So what it's showing is at the very high dose of PRP at 10 billion platelets that we were able to protect the cartilage and not have any increased wear of the articular cartilage at 1 year. What does this mean long term? It means long term that if we injected the knee every 12 to say 16 months, we could potentially prevent the need for knee replacement. If we could maintain the articular cartilage, not have increased wear, the patient would not have increased pain and would not need to go on to knee replacement. So I think that this is a significant outcome of this study, looking at the chondral protection of the PRP in the knee joint. The last thing they looked at was they looked at function. They looked at a 6-minute walk. Now, on the 6-minute walk, what they do is they count steps, and they found that at 1 year, the PRP group had an average increase of 129 steps in 6 minutes. In the HA group, it was essentially unchanged. The only change was about 4 steps from point 0 to the 12-month point of the study. So we showed increased function, decreased pain, and chondral protection in the PRP group. All 3 things they looked at had improvement. The other thing they looked at is they actually did fluid analysis of the inflammatory markers within the synovial fluid at each of the visits. And what they found is a significant downregulation of inflammatory markers, especially at the 1 month period. They looked at both IL-6 and TNF-alpha, and they found a downregulation of both of those. Now, we know both of those inflammatory markers, both of those cytokines, do cause both pain and degradation of collagen, destruction of articular cartilage. So downregulating those early on after the PRP injection is being very, very helpful. A lot of this came out of Dr. Scuderi's initial studies looking at alpha-2 macroglobulin and how alpha-2 macroglobulin downregulates inflammatory markers, especially MMP13, which is associated with the progression of osteoarthritis. I will do another regenerative moment on alpha-2 macroglobulin and how that works to actually stop the progression of osteoarthritis. And I'll do that coming up sometime in the next month or 2. So when we look at this study, we are looking at the 3 significant outcomes, both decrease pain, increased function on the WOMAC score, increased ability to walk at 1 year, and no loss of articular cartilage. It definitely proves that the PRP group does have some chondral protection and does have some favorable long-term outcomes. The one downside, as I said earlier, was the amount of PRP that was injected, 8 cc's. But they were looking to get to that 10 billion platelet mark. Now, a lot of you may be thinking, well, 10 billion platelets is a lot. How can they get to that number? And I can do the math really quick for you. So if we look at what is a normal platelet count. So a normal platelet count, if we run it through LabCorp or Quest, is usually 150,000 to 450,000. So we can make the math easy. We can say that just for explanation purposes, that 200,000 is the number we're going to use. So what is that? That's 200,000 platelets per microliter. So now when we draw our blood, we're drawing our blood in milliliters. So between microliter and milliliter, it's a 10 to the third increase. So if we increase this by 10 to the third, that's going to be 200 million platelets per milliliter. Now, if we look at some of our double spin centrifuges, we can draw 60 cc's of blood. So if we say we're drawing 60 cc's of blood, and we know that we have 200 million platelets per milliliter, that's going to transfer to a total of 12 billion platelets. So we can concentrate that 12 billion platelets down with a second spin of a double spin process to whatever amount we want. We can concentrate that down to, say, 5 cc's. Almost everyone could tolerate 5 cc's in their knee joint. So we would have about 10 to 12 billion platelets in 5 cc's. That's how they came up with this number. I hope that you find this article as interesting as I do. I hope that we see it in a big orthopedic journal at some point. I will attach the article below this video so you're able to look at the entire article and all the numbers that they collected, all the data. If you have any questions regarding the video or the article, please reach out to me. You know that I love the use of PRP in the musculoskeletal system to help with osteoarthritis. If you have any questions about how they went through the study or how to get these types of results in your own patients, please reach out. Look forward to providing another video for you sometimes in the next 2 to 3 weeks. I hope you enjoy the rest of your weeks and stay healthy. Bye-bye.